Though still related to tetralogy of Fallot and right ventricular overload, INRIA's electromechanical models have been clinically dedicated to building pressure volume diagrams, three-dimensional strain and stress, simulating the effects of pulmonary valve replacement, determining when such an intervention to replace the valve should take place, and what the effect of such an intervention may be. Let's listen to Tommaso Manzi explain the advantages that electromechanical models have.
What is tetralogy of Fallot? So I will skip all these slides. So the main idea is that tetralogy of Fallot is a severe congenital defect with four symptoms, let's say, that requires surgery early in infancy. The surgery, as we have explained, led to extreme dilation of the right ventricle, which is here, because of severe regurgitation due to damaged pulmonary valves that have been damaged during this initial repair. If you do nothing, the patient may die after 40 years. This is the life expectancy of these patients. So one solution is that during teenage or early adulthood, we replace the valves to these patients in order to increase their life expectancy. And there is a question of when is the best timing for valve replacement. And you have to find a compromise, as I explained yesterday. And there is also the other question, which is, okay, let's assume that now I know that it's the right time to put the valves. What will be the effect of the valve replacement of that given patient? So these two questions, nowadays, there is no consensus. And the idea is, why not using electromechanical models of the heart to try to predict in some ways the effect of that therapy on a given patient? If we can answer this question, then it will be very easy to say, okay, for this patient, I just need to put the valve and it will be okay.
With electromechanical modeling, to date, there has always been a trade-off between the accuracy of the models and their ability to be personalized. Healthy Child has not solved this conundrum, but it has made some exciting steps in the right direction, as Tommaso Manzi is telling us.
We were quite excited by the results, but personalizing an electromechanical model is very challenging. You always have to do some compromise between the accuracy you want and the ability to personalize it. The more accurate you are, the more parameter you want, you need to personalize, and the more difficult it is. And then you have to choose the model according to the clinical question that you want to ask and predict, and also according to the data you have. If you have sparse data and just EKG, it's useless to use a very accurate model because you cannot personalize it for this given patient. If you have a very comprehensive data with a lot of accuracy, then it's worth to use more complex models. And if you want to predict something which is very punctually that needs accuracy, then yes, you need a more accurate model. So it's very important to ask this question, what do I want to simulate, what do I want to predict? In Healthy Child, we designed a framework which is modular to personalize the electrophysiology of the cardiac function of a patient and do some surgery. The fact that it's modular is that we can change each pieces and improve it or adapt it to the clinical question we want to solve. And as an application, we showed that we can personalize, in some sense, the electromechanical model in this patient of tetralogy of Fallot. We did some surgery. We found that direct removal improved the function, but of course surgery is quite hazardous for a patient, and if we can avoid it, better for him.